Tonight, Ohio's mountain of COVID-19 cases keeps getting steeper. And if you aren't following the proper precautions, Thanksgiving could turn into a super spreader event. Thanks for joining us and happy Thanksgiving. I'm Andrew Kinsey. Yolanda has the evening off. There are no new case numbers to report tonight here in Ohio because of the holiday, but the spread is evident everywhere. Nowhere is that more clear than in Fairfield County, where the rate of cases per 100,000 is almost 4 times higher than what it was a month ago. Chief investigative reporter Bennett Haberly spoke with the county hospital CEO about his main concern tonight.
Right now, we can't logistically take you inside the Fairfield Medical Center. Visitations here are restricted. But know this, there are nurses and doctors and other healthcare workers inside this holiday caring for those sick with COVID-19. And their boss fears they're growing weary.
They care about what they're doing, their hearts are in it. But at some point in time, they're going to exhaust themselves. They're only human beings.
Jack Genoso is president and CEO of the hospital. If you've ever talked with the CEO, there is a tendency to discuss optimistic outlooks, projections, best case scenarios. Genoso used words like concerned. He's not worried about running out of bed space, but the strain the pandemic has put on his staff.
They do an amazing job of caring for people. They do it from their heart, and they're tremendous. But the value of the longevity of this pandemic and its increasingly severe number of people that are walking through our doors is alarming to me.
Take a look at the statewide advisory map for comparison. On October 29th, less than a month ago, Fairfield County's rate of cases per 100,000 was 233. Fast forward to November 26th, that rate is now 840 per 100,000, nearly 4 times higher and among the worst in central Ohio. Hospitalizations statewide have been rising for weeks.
I think the greater concern, as you're probably hearing from all our colleagues across the state, is that the demand is beginning to exceed the supply.
The hospital, he says, has had to reorganize, spreading out critical care staff to other areas. The people behind these walls need a break, and Genoso says you can help.
If you have a safe bubble, right now is not the time to cross those bubbles, because 2 weeks later, we're going to see another rise in sickness that comes from people trusting their loved ones not to make them sick. They don't intend to, they just don't know that they're sick.
The numbers are a reminder, he says, to alter behavior.
We have to protect ourselves if we're going to protect our community. And that's tough, because everybody needs that respite. Everybody wants to be with their family. Everybody wants to be able to feel normal again, but we're not quite there yet. And being too selfish about that up front is going to cost people their lives.
Bennett Haberly, 10 TV News.
Genoso says in addition to canceling those holiday plans, wearing a mask and social distancing, we can do other things to help our frontline healthcare workers. Let them know we care. Consider sending a healthcare worker you know a thank you note, letting them know that you're grateful for all their effort.